Hi there, I'm Kelly Dean.
And I'm Jillian.
We're from the Tummy Team, and we're going to talk to you about all the things you need to know about splinting while you're pregnant. Abdominal splinting while you're pregnant. It has a lot of really great benefits, but there's a lot of misinformation out there. And the first thing I want people to understand is most of the time we don't encourage people to splint in their first trimester, and even later in your pregnancy, we only encourage abdominal splinting in conjunction with other things you're doing, like some alignment work, some core strengthening. It's always to be used as a part of the core preparation and core rehabilitation process. We usually have people splint maybe if they have a diastasis that's 2, 3, 4 fingers or more wide, a separation of the abdominal wall. If they're having any kind of back pain or pelvic instability or fatigue, and usually it starts sometimes around the second trimester, and it's usually intermittent. And a lot of people ask us, what is intermittent? And intermittent means not all day long. It means to put it on at the hardest part of your day and wear it for maybe a few hours for support and to give you awareness and connection to, maybe at the end of the day when you're getting dinner ready and getting your kids ready for bed and that kind of thing, or you're going for a walk or something like that, or times when you're just feeling fatigue and you need that extra support, but not necessarily wearing it for like 10, 12 hours a day. As you progress in your pregnancy, sometimes you can start adding a little bit more time with your splint. In the end of that third trimester, we sometimes have clients splinting 6 to 8 hours of their day as a part of that extra support. But we're also working with them on how they're holding their alignment and how they're engaging their core and how they're breathing and how they're moving and all of those things. So it's a part of a process. We're going to show you today also how to measure for a splint, and then Jillian's going to put her splint on so that you can see how to put on a splint around a belly bump. Okay, so we have our tape measure. We're going to measure right around the belly button. So for her, she is, not engaged, not relaxed, just kind of weird. There you go. She's naturally always long, lean, and lifted. She's at about 41. 41 puts her into our large splint. If you're kind of on the cusp there, if you're at like 39, I want you to kind of prepare for what you're going to need, because you're going to need your splint more as your pregnancy progresses. So you'd probably move up to the bigger size. But if you really are like at that 37, 38 and you feel like you need your splint now, go ahead and get that small, because it will stretch a little bit and you don't actually gain as many inches as you think you do. You get bigger, but it doesn't actually calculate into the inches the way you might think. So sometimes if you're on the cusp, it's tricky, but usually look at our measurements and kind of figure out where you're at. 41 is going to be a large 3-panel for her. And then we're going to have her bend her hip a little bit. Okay, and I'm going like right underneath her bra strap to where her crease is. That's 8. Okay, our 3-panel splint is going to cover at about a 9. If I go up and over her belly, we're getting closer to an 11 or a 12. So we have a 4-panel splint that goes 4 inches in height. But if we did that 4 inches here, it would be down over her bum and it'd be very uncomfortable. So even though it will cover more of her belly, it's 4 all the way around. So you want to keep that in mind. More often than not, people need the 3-panel. Even when they have a lot of belly, the 3-panel is going to feel more comfortable. But we do have a 4-panel if you are long-waisted and you have quite a bit of belly. So if you're measuring closer to like a 10 or a 10 and a half here, and then larger over the belly, then I would go for a 4-panel. But if you are 9 or less, then you're going to go with the 3-panel. All right, so let's grab your splint. And she's going to show you how she puts her splint on. And this is the splint she's actually been wearing in this pregnancy. How many weeks are you?
I'm 30 weeks right now.
30 weeks.
Yes.
It's exciting.
So this is what we do. Long, lean, and lifted.
So she takes her breath, kind of elongates and draws her belly button in, and then she's going to bring it around and attaches the bottom first, and then works on straightening out and getting the top. And she can adjust. Like if she feels like she needed to tighten this little part, lower part up, she could. Notice how she didn't put it as tight as she possibly could. right? It's supposed to be snug and supportive, but not tight like a tourniquet. We're not trying to restrict any kind of blood flow here, anything like that. We want it to just, as she engages her core and brings belly up and in, that this is reinforcing that position and alignment. Couple of major common sense things. If the splint should always make you feel better. That's a bottom line. If it makes you feel worse, take it off. It's not worth it. The benefits are not worth the negative effect of any kind of negative symptoms. So you should never feel increased pain, shortness of breath, overheated, nauseous, none of that. Any of those things you're not going to want to, that's not a good experience, and the splinting is not helping you. If you're wearing it nice and supportively and it feels like a snug hug around your belly and it just takes a little bit of that pressure off, don't you think when we put it on clients, they put it on, they're like, it feels so good. It just relieves some of those muscles right away. It can be such a great support for you. If that's the case, then you're doing it right. All right, so there are some other kind of things just to think about with splinting, because you may wear it during your pregnancy, but often it's nice to have to take with you to the hospital, because you get tired in labor, and fetal alignment is affected by weakness and collapsing of your core muscles. So if you have your splint with you while you're laboring, it can be a real great tool. And we even have clients that sometimes like to use their splint while they're pushing. And that makes more sense when you go through our Prenatal Core Training course. But the splint actually kind of helps you. If you were to engage your core right now, take a breath and engage your core. Far easier to do with the splint on than without the splint, because it kind of gives you a little bit of a boost, right?
Yes, and you have that feedback of which muscles you're actually using.
Yeah, so it can be really helpful. So there's a lot of reasons why you might want to splint when you're pregnant. One last question that we get all the time is, what if my baby's breech? Should I be splinting? Probably not. So this does not really keep the baby from moving, but when you have a poorly presented baby, you don't want to give it any options to want to stay comfortable that way. So usually, if somebody's really struggling to get their baby to turn, we usually tell them not to splint as much, to go through all the procedures that you can help to get the baby to turn. There's lots of information about that out there. And then once they know baby's head down, that's a good time to put the splint on, because it kind of gives that snug feeling, and it's less likely for the baby to move out of that position again. All right, so hopefully that answers some of your questions about splinting during pregnancy. And obviously, Jillian has it over her sweater, but if she was gonna wear it out and about, she'd put it on a tank top first and then put the splint on and then put her shirt over it, so you don't see the splint. But this is just easier for you guys to see. All right, thanks so much.